Welcome clients and guests to my channel. I'm Jason Serro and I'm a licensed professional counselor. My videos are designed to educate and empower you to make informed decisions about your mental health. Hey everybody, thanks for tuning in. Today you're going to get an inside look as to the skills and the way that we as clinicians implement these strategies into someone's treatment plan. And today is going to be more about dialectical behavioral therapy, where it has a lot of the skills in each of the components. So you'll be able to take away a lot of skills from this, and you'll be able to put this into your life, whether it's your own therapy if you're in counseling, or you could do this at home. You could watch this over and over and take a look at it, and then there's lots of examples in here for you to take away and plug it into your life. DBT is one of many psychotherapy models. There's tons of them out there, and this one I really like, and I like going through a lot of the skills. There's others that I'll talk about also over time, so this will be a playlist, and it'll be a series of videos, so you'll have these videos in order. And this first one is just about giving you a little bit of background as to what it is. And then as time goes on, you'll see with each slide, there will be some skills really quickly put into these tutorials. So take a look and watch them a couple times if you have to, take notes if you want to, and ask any questions that you have. Be sure to contact me and let me know what you think, what's working for you, and any questions you have, feel free to reach out. So DBT which has a crossover with cognitive behavioral therapy because of it's very behavior based, and there are also models that are not behavior based. They're more insight oriented, like psychodynamic versions, which I'll get into at a later time. DBT was originally developed by Dr. Marshall Linehan for borderline personality disorder, but it was later found to be effective for anyone to help identify, accept, express, and manage their emotions through effective skills and solutions. Borderline personality disorder is one of the most misunderstood personality disorders that I've ever come across, because it has so many different dynamic components to it. And I'm not going to get into all of it because that's a whole new video and a whole new series, and I want to give the attention that it deserves at a later date, but I'll just give you just some quick background on what it is. It was a very difficult disorder to treat and was unsuccessful in the early years with different models. But it was found, Dr. Linehan really found this DBT to be effective in helping the extreme behaviors and affect and thoughts that people with borderline personality disorder have. Because it's based on a fear of abandonment, whether that person is pushing somebody away, or they fear that the person is going to get too close and then ultimately leave, so they leave the person before the person leaves them, which could be either real or imagined, they call it. They have chronic feelings of emptiness. Often clients will tell me there's just this real hole in them, or they feel nothing at all. It's that emptiness, and it's really chronic, and it can be daily, but it can also be episodic. And chronic feelings of anxiety. Those are three of the main criteria. They're very anxious and neurotic and on edge often. Very protective, and it has, like I said, it has extreme ends, and there's a lot of black and white thinking and pretty extreme or push it to the limit behaviors like self-harm and suicidal ideation, which can come out of nowhere, and a lot of these symptoms that come in along with impulsivity that come in all at one time, and it's like a storm. It really overtakes the person and floods them and makes them really dysregulated. So, but it's a very misunderstood disorder. The people actually who have this disorder I have found to be really good people, very intelligent, care a lot about things, and sometimes too much. They care a little too much about things and take things very personally. So it's very difficult for them to take in all that input and decipher it. It's very difficult to sort it out in a chronological way or an orderly way, and that's part of what DBT tries to do.